Welcome, everyone. Thank you for coming. I'm Andrei Hall, president of Hall Wealth Management. And over the next 45 minutes or so, we're going to talk about some of the things you need to know about healthcare when planning for your retirement. As always, we're here to help and navigate you through Medicare. If you feel there's anything you'd like to know more about how to take advantage or need clarification at the end of this experience, there will be a link to schedule an appointment. We take great pride in helping you through this hectic time and assist in any way we can at no cost to you when it comes to Medicare. Let's get started. Okay, let's begin with the most basic of basic. What is Medicare? A national health insurance program. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Some people under 65 can get Medicare if they receive Social Security disability benefits. But our discussion today will pertain to the first group, people over 65. Medicare is divided into 4 parts. Part A covers the cost of hospitalization. Part B covers the cost of medical services, such as doctor's visits, procedures, and diagnostic tests. The bills for Part A and B are paid by Medicare. Part C and D are where the private insurance comes in. Part C is an alternative way to get Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all of your services under Part A and B, and usually prescription drug coverage as well through the plan instead of Medicare paying for hospital and doctor's bills. It pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing and coordinating your care. Part D is prescription drug coverage. It is offered by private insurers who contract with Medicare. Each drug plan is slightly different, which is why you'll want to shop carefully for your drug plan. Even if you don't take any prescription drugs when you first go into Medicare, you'll want to sign up for a Part D drug plan, because if you go without drug coverage for very long, you'll face a penalty when you finally enroll. This image shows 2 ways to have Medicare. If you go with original Medicare, you sign up for Parts A and B. Then you decide if you want prescription drug coverage under Part D. This shows drug coverage as optional, but it'll be dangerous to go without drug coverage. I think we all realize that. So we recommend that everyone plan to have some kind of drug coverage starting from the outset of Medicare. And quite frankly, you can never cancel it. In step 3, you decide if you want supplemental coverage. Again, Medicare shows this is optional, but if you're going to have regular original Medicare, you're going to want the supplemental coverage, because without it, it leaves too many gaps. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. There are many companies in this area. So if you go this route, it will be important to shop for plans and find the one that meets your needs, has the doctors you want, the specialists, etc. And again, drug coverage is often shown as an option, but we would recommend that you choose a Medicare Advantage plan that offers prescription drug coverage included in it. Choosing how you take Medicare is a big decision. It needs to be individualized, and we can't go in depth here today. We can get you around certain pitfalls though. Enrollment. Here are the fundamentals. This is the main principle. Unless you are covered by an employer group plan that covers 20 or more employees, You must enroll in Medicare when you turn 65. What if you don't enroll in Medicare on time? The consequences are pretty bad. First, you'll be charged a late enrollment penalty. The longer you go without enrolling, the higher the penalty will be, and it will continue for the rest of your life. The second consequence is that your health care expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, the private insurers that coordinate with Medicare have to take you if you sign up for Medicare during your enrollment period. But if you don't, and you go to apply for private insurance later, you may not be able to get insurance, or you may be charged a higher premium. If you're receiving Social Security when you turn 65, you'll automatically be enrolled in Part A and B. If you're working and covered by an employer group plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Medicare Parts A and B, and your coverage will start on the first day of the month you turn 65. Part C and D are not automatic. If you want a Medicare Advantage plan, you'll have to contact the insurance company that you choose that's offering it. Or if you want to stay with the original Medicare and have a standalone Part D prescription drug plan, you'll have to decide which insurance company's plan you want to go with. And you'll have to proactively enroll. You should do this at the same time you enroll in Part A and Part B, before your 65th birthday. There are several prescription drug plans and Medicare Advantage plans available depending on your area and zip code. If you get overwhelmed, it can get overwhelming comparing and figuring out which one is best for you. It's also important to remember what may work for you and your best friend. What may work for you may not work for your best friend. We are here to guide you through step by step, find available plans in your area, compare, and then comprehensively explain the plan to you. We're proud to do the work for you, and our assistance is always at no cost to you for Medicare. What if you're not receiving Social Security when you turn 65? More and more people are continuing to work, or at least delaying the start of Social Security, hard to get out after you say it so many times, in order to receive a higher benefit. In this case, you'll have to proactively enroll in Medicare during a Medicare enrollment period. There are three main Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees. And you'll hear that number several times here when you turn 65. If you're not covered by the employer group plan because you or your spouse is still working, you have a special enrollment period, which I'll explain in a moment. If you miss either one of these enrollment periods, you can sign up for Medicare during the general enrollment period. The initial enrollment period for people who aren't covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after you turn 65. Although it lasts a total of 7 months, you really should plan to enroll in Medicare during the 3-month period before you turn 65. Then your Medicare coverage will start on the first day of the month you turn 65. By the way, if your birthday happens to be on the first day of the month, everything is moved up a month. Just pretend your birthday is in the previous month. For example, if your birthday is June 1st, your initial enrollment period would start February 1. And if you sign up during February, March, or April, your coverage will actually start on May 1. We've been talking about signing up for Medicare as a whole, but there are times when we need to break it into parts. Most people will sign up for everything all at once, but there may be times when you want to sign up for some parts and not others. If you're still working when you turn 65, check with your benefit administrator to see if you should sign up for Part A. We mentioned earlier that if you're covered by an employer group plan when you turn 65, you have a special enrollment period that comes later. However, you may want to sign up for Part A because when you first become eligible, the reason is the reason really is that it may offer better coverage for hospitalization than your employer's group plan. Part A is usually free to you, but check with your benefits administrator anyway. If your employer group plan is a high deductible health plan paired with a high savings account, and if you want to keep contributing to that health savings account, you should not sign up for Part A. The reason is that once you enroll in Medicare, your HSA contributions must stop. But let me be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during the initial enrollment period at 65. If you're not covered by the employer group plan when you turn 65, you will want to sign up for Part B during your initial enrollment period, preferably that 3-month period before your 65th birthday. So if you're not working, if you're self-employed, if you're employed by a company that has fewer than 20 employees, if you're on COBRA, even if you're receiving retiree health benefits, you'll want to sign up for Parts A and B during your initial enrollment period. If you sign up for Parts A and B during your initial enrollment period and you think you will ever in your life want prescription drug coverage, you should enroll in Part D at the same time. If you go more than 63 days without credible prescription drug coverage, you will pay a late enrollment penalty when you finally sign up for Part D. So it's better to go ahead and get your drug coverage from the outset, even if you aren't currently taking any drugs. As mentioned before, you have 2 options. You can enroll in a standalone prescription drug plan if you have original Medicare, or you can get your drug coverage through Medicare Advantage. If you sign up for Part A and B during your initial enrollment period, and if you think you will ever in your life, I'm sorry, on the wrong slide. Okay, now we're going to talk about the special enrollment period. This is for people who were covered by an employee group plan that covers 20 or more employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. The best time to sign up is before your current coverage ends. That way you'll have no gaps in coverage. But actually a grace period of several months to avoid the late enrollment penalties, but you still don't want to have gaps in coverage. For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, it's only 63 days. To summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period. But to avoid gaps in coverage, which is even more important, you should sign up before your current coverage ends. What if nobody ever told you that Medicare enrollment periods, about Medicare enrollment periods? If you don't sign up when you're supposed to, you can still sign up, but now you have to do it during the Medicare's general enrollment period. I know all this can be confusing, which runs from January 1st to March 31st of each year. This is the only time you can sign up for Medicare if it's outside your initial or special enrollment period. Coverage starts July 1st. So you can see if you sign up between January and March, even if you sign up January 1st, you got to wait 6 months before you get coverage, which means you don't have any coverage. And unfortunately, that's when a lot of things happen when you don't have the coverage. Okay, let's take a quick review of Medicare enrollment periods because this is important. The initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers 20 or more employees. The best time to sign up is 3 months before your 65th birthday, and Medicare coverage will start on the first of the month when you turn 65. The first month you turn 65, excuse me. The special enrollment period is for everyone over 65 who is covered by a current worker or spouse of a current worker under an employer group plan that covers 20 or more employees. The best time to enroll in Medicare is before that coverage ends. Then your Medicare coverage will start on the first month of enrollment. The general enrollment period is for people who did not attend this presentation and didn't know they need to sign up for Medicare during their initial or special enrollment periods. They can sign up between January 1st and March 31st of each year with coverage starting July 1st. How do you sign up for Parts A and B? It's very easy. As I mentioned, if you're already receiving Social Security when you turn 65, you're automatically enrolled in Medicare. If not, you can go to ssa.gov, click on Medicare, and click on the big Apply for Medicare Benefits button. Or you can do it by phone by calling the number that you see on the screen. Part D isn't quite as straightforward because first you have to decide how you want your prescription drug coverage, whether you want a standalone prescription drug plan or a Medicare Advantage plan. In either case, you'll be shopping for plans offered by private insurers. Once you've decided on original Medicare versus Medicare Advantage, and then chosen a specific plan, you can enroll in Part D through the insurance company or through Medicare. I mentioned this early, but I want to remind you, you can always reach out to us to help with this part. Looking for plans can be time-consuming, confusing, and overwhelming. We do all the legwork for you, and the assistance is always at no cost to you for Medicare planning. And this brings us to Part 2, Medicare and private insurance. Focusing on out-of-pocket costs by Medicare beneficiaries. They fall into two main categories, premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and to the private insurance companies offering drug plans and Medigap policies or Medicare Advantage plans. Out-of-pocket costs include deductibles, the portion of the doctor's bills not paid by Medicare, and the services not covered by Medicare. So bills not paid and services not paid, not covered by Medicare are things that are out-of-pocket costs. First, let's look at monthly premiums. Part A is free. If you or your spouse have paid into Medicare over 10 years. Again, free if you and your spouse have paid into Medicare over 10 years. This is one reason most people sign up for Part A when they turn 65. Even if they're covered by an employer group plan, it doesn't cost anything. Part B is different. It costs $148 per month in 2021. It goes up each year due to inflation. Also, if you're a high income and you say, well, I'm retired, so why will I have high income? Between Social Security, any other kind of retirement pensions or IRA dollars you're taking out, that all is counted as income. And so Part B premiums Part B premiums and Part D premiums can be more than the minimum amount. This table shows Part B and D premiums for the different income levels. If you're single and income is under 88,000, or if you're married and your income is under 176,000, you'll pay the regular Part B premiums of $148 a month. But as you can see there, depending on your income level, and again, this counts everything you're getting, it can go up tremendously, especially for a married couple. So if in fact you're a married couple and you're paying a excess cost because of income, you got to multiply things by 2. And it looks at the last, your tax return from 2 years ago, i.e. for 2021, it'll be your 2019 tax return. And this is for Part B and D only. Deductibles. In addition to premiums, there will be some other out-of-pocket costs under Medicare. If you have to be hospitalized, the first $1,484 in hospital costs will come out of your own pocket before Medicare starts paying. Some private insurance plans cover this, as we'll see in a minute. Part B premiums is a reasonable $203 per year. And this is waived for some preventive services such as flu shots and certain screenings. Part D deductible is $445 per year under the standard Medicare design. Part D coverage is quite complicated, and we'll see that in a minute. As you can see, Medicare is great, but it's not free. After you've met your deductibles, there are some other costs. Medicare doesn't pay your entire medical bills. If your hospital stay exceeds 60 days, you'll be responsible for $371 per day up to the 90th day, and then $742 per day up to the 150th day. After that, you'll pay the full boat, the full cost. Medicare pays the full cost of 20 days of skilled nursing care. After that, you'll pay $188 per day for days 21 through 100. If you need more than 100 days of skilled nursing, you'll pay the full cost. As for Part B, your responsibility is 20% of the Medicare approved costs. So if your cost, Medicare approved cost is $100, you pay $20. Doctors who accept assignment agree to be paid directly by Medicare and will not bill you any more than a Medicare approved amount. Doctors who don't accept assignment may charge more. If they don't charge more than 50% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest, the 20% plus the 15% overage. Under the standard drug plan design, the beneficiary pays a $445 deductible. Then 25% of drug costs after that deductible has been paid. Then there's a small co-payment once out-of-pocket costs have reached $6,550. But drug plans vary widely. Some will pay more, requiring you to pay less. It would be important to find a plan that covers the drugs that you take. After looking at all of these out-of-pocket costs that you have to pay, you might be wondering what Medicare does cover. Well, it covers the first 60 days of hospitalization minus the deductibles, of course. It covers 80% of your doctor's bills, and it covers some preventive services. The best references for finding out what Medicare coverage is the Medicare and You book. To get it, you can call the number above or go to medicare.gov. If you have a specific question, we'll be happy to be your point of contact at Hall Wealth Management. You can always reach out to us with a question pertaining to Medicare. The Medicare and You booklet spends over 20 pages talking about what Medicare covers, and only one page talking about what it doesn't cover. I'm not talking about partial payments. I'm talking about no coverage whatsoever. For the list of services you see here, some of these things you can avoid and don't have to do, like cosmetic surgery. If you never go outside the United States, you don't have to worry about these things. But some of these other things may be necessary. Dental work, eyeglasses, hearing aids. There are things you'll have to cover yourself. This is where private insurance comes into play. Private insurance can cover all or part of your deductibles. These hospital costs after 60 days and 20% of your doctor's bills that Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone doesn't cover them. Depending on the drug plan you choose, it may cover the deductibles, and it should cover the cost of certain drugs during the initial benefit period. Catastrophic coverage period. But it won't cover all drugs. Each plan has its own list of drugs, and it won't cover much if anything is in the donut hole. Medicare supplement insurance, commonly called Medigap policies, are issued by private insurance companies and are designed to fill the gaps that Medicare doesn't cover when you have original Medicare. Although they are not affiliated with Medicare, they do have to follow certain federal and state laws that are designed to protect you. Medigap insurance policies are standard. They're identified by the letters A through N. So if you buy a Plan F in California, it will offer the same benefits as a Plan F in New York. The only issue is, however, the premiums can vary widely. For example, in Florida, the monthly premiums for Part F can range from $192 to $465 per month for the exact same policy. That's why it's so important for you to carefully evaluate Medigap insurance and policies and not to pay too much for them. We don't have time to go in depth here. You'll have to do your own research to determine which Medigap policies work for you. If you like, I can help you with this, and there will be an opportunity to schedule an appointment shortly at the end of this presentation. Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing that care. You will have to use the network of doctors or hospitals in their network, i.e. like an HMO. You'll want a plan that includes prescription drug coverage, and you may even be able to get extra benefits like vision care. But the benefits and cost sharing for Medicare Advantage plans are different than for original Medicare. So again, you need to shop carefully and choose a plan that fits your needs, has the doctors you want, and the hospitals you would want to go to. We take pride in offering a complementary needs analysis at no cost to you so that we can determine the best Medicare Advantage plan for you if you choose to go that route. And this is just a reminder, once again, to shop carefully for private insurance. Medigap policies are standardized, but the premiums can vary considerably. First, choose a plan that offers the coverage you need. Plan F is the most comprehensive plan. Then choose a reputable company offering that policy at the lowest price. And before signing up, check with your provider's billing department to make sure that they will pay the bill directly versus you having to pay the bill and then going for reimbursement. Drug plans benefits vary considerably. If you don't take any drugs at present, you can choose the cheapest plan available. You can always switch to a more comprehensive plan later. If you do take prescription drugs, you'll want to examine each plan's drug list to see what kind of coverage is provided for the medicines you take. And the same with Medicare Advantage plans. Evaluate each plan's offering and cost and make a clear choice about which insurance to go with based on your individual needs. As a wrap up, we're going to talk briefly about overall healthcare costs. We do not want to get into the weeds here, but if you have a realistic understanding of the challenges of building a retirement healthcare budget, if you're going to have that understanding, we have to go over some basics. What can cause healthcare budgets to change? Two things: inflation and the possibility of getting sick. We're all living in a lot longer than what our parents, for the most part, and grandparents and great-grandparents live. As healthcare costs continue to rise, insurance premiums go up, and the non-covered services that you pay for yourself get more expensive. If you get sick, you may need more expensive prescription drugs and have to spend so much that you find yourself in the donut hole, having to pay many thousands of dollars for your medications. Again, the donut hole is that part that the plan doesn't cover, okay? And it's like it covers the beginning, you got the donut hole, then once you pass the donut hole, it starts covering again. I don't know why they did it that way, but they did. And there's always a possibility that as you age, you'll require more non-covered services like major dental work, hearing aids, or long-term care. How can you plan for rising health costs when you might be on a fixed income when you retire? Well, basically, you got to plan for it. You got to put away the funds or have a way of access to funds. Quite frankly, if you put your kids through college or they are a professional athlete, you probably have access to funds for later on in life for healthcare expenses. But otherwise, you're going to need to plan for it. And I say put your kids through college. Even if we put our kids through college, they're not going to have the money most of the time to help us pay for these additional healthcare costs in retirement. You can see the average couple is going to need around $295,000. And there's a couple of different sources that have looked at this. This is by Fidelity. And then another Employee Benefits Research Institute did a study. They came up with $270,000. So these are just averages. If you live in a high cost state like California, New York, Connecticut, New Jersey, and several others, it can be more. If you're in the Midwest, it can be a little less. How many of you know someone who got old and needed long-term care? I've gone through that personally. We're not necessarily talking about nursing home care. Long-term care costs can range from someone coming to the home for a few hours a week to help with meal prep to skilled nursing care. The important thing to know is that Medicare and Medigap do not, I'm going to repeat myself, do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, and I experienced that with my mother, they're not going to pay for it. The average period of skilled nursing care is just 28 days. And when it comes to custodial care for help with activities of daily living, there's no coverage at all. How much does long-term care cost? Well, it varies the type of care, of course. Genworth has done a number of studies, and they found that basically we were looking at $140 some odd a day. If you send your parent, as an example, to an adult day center, it can be somewhere around $75 a day, and these are average costs. If you go to an assisted living facility, they can range from $2,000 per month to $7,000 per month. The most expensive type of care, of course, is nursing home, where residents can get skilled nursing care. A private room. We would all like to have private rooms at that stage in our lives. It can be from $200 per day to $1,000 per day. The medium rate is $280, but the very nice ones are closer to that $1,000 a day. Even at $280, you're spending over $100,000 a year. None of us want to think about getting old and needing long-term care. And I gotta mention, I seen a sign when you're driving from like Orange County to San Diego. There's a sign up that says the first person that is going to live to be 150 has just been born. You can bet they're going to need some long-term care. None of us want to think about that again, but there are compelling reasons why we need to. One is to spare our kids or family members the burden of taking care of you. They might not mind doing your shopping or paying your bills, but they don't want to do the bathing and dressing because, quite frankly, that's really beyond the call of duty. Your son or daughter is going to have their own families. Many cases, they're going to have a job, and they would have to give all of that up. Another reason to plan for long-term care is to avoid having to spend down assets in order to qualify for Medicaid. A lot of people say, well, I'll go on Medicaid. This is a state-run welfare program, and it will pay for your care if you don't have any money. The phone ringing. But that's the point. You have to spend down assets to less than $2,000 in order to qualify. So once you get down to less than $2,000 in assets, that's when you qualify. Basically, you're destitute. And people on Medicaid don't have a lot of choices of the kind of care they receive. This is another reason to plan for your own long-term care, to be able to direct your own care and obtain the kind and quality, again, quality of care that you want. When you're paying for it out of your own funds you've set aside for this purpose, or insurance, and that's where insurance is very important. You can decide what kind of quality you want. There's a lot more to say about planning for long-term care, but our time is nearly up. I want to leave you with 3 reminders that relate back to the 3 key points I talked about at the beginning of this presentation. Enroll in Medicare on time. When you hit sign up for hit 65, make sure you have already signed up beforehand. Shop carefully. Evaluate all your options and choose the right private insurance plan and drug plan, Medigap policy or Medicare Advantage plan that offers the coverage you need at a price you can afford. Don't be one of those people that pay too much for private insurance because they don't know any better. And finally, plan for your higher health care costs in retirement. We know health care expenses will be higher than they are today. So when you're planning for your retirement and figuring out how much savings you'll need, be sure to factor in that extra amount for health care and inflation. If you've heard anything today that you feel would be beneficial to look at regarding Medicare, please take a look at the Zoom chat. There's a link there for you to click on to schedule an appointment with me and my healthcare expert for a complimentary needs analysis. If you feel there's something you need clarification on regarding something you heard today or have a generalized question, feel free to schedule an appointment as well. I'm happy to help. This concludes our presentation today. Thank you for taking the time out of your day to attend and learn more about Medicare. Please feel free to reach out to us at any time. Medicare assistance is always at no cost from my office, and it's our highest honor to help you navigate Medicare. Have a great day and take care and be safe.